a heart attack or stroke, although again, if they sit back, you all know someone who's had a heart attack or a stroke. Most women said it was breast cancer or lung cancer. And so this is something that we need to overcome if we're going to impact women and cause them to begin a regimen of prevention and to act aggressively to prevent heart disease. 1 in 3 women will die of heart disease. In some studies it's even higher, it's 1/2 of women. 1 in 30 women will die of breast cancer. If you look at women dying annually, 213,000 women die annually of a heart attack, 41,000 die from breast cancer, and 69,000 from lung cancer. So the numbers don't lie. Heart disease and stroke are really major problems within our community. And if you look at all cancers, 260,000 women die of all cancers. Heart attack and stroke is going to kill 500,000 people this year, 500,000 women. So I said earlier that we don't do too well, physicians in the healthcare community don't do very well with treating women, and we'll talk about some of the reasons. Look at this. 2/3 of women who die from a heart attack have had no symptoms prior to having a heart attack that kills them. That's why they call this the silent killer. You're walking around, you just had lunch with your family, had Sunday dinner with your family yesterday, and then the following day you have a heart attack or stroke. How many people have seen someone at church, seen someone at work last week, they look perfectly fine, and then the next week you heard that they were in a hospital, or maybe even worse than that. And so it is truly the silent killer, and that means that we need to emphasize. Then after she gets to the hospital, she may tell the emergency room doc, "Hey doc, I'm feeling a little bit nauseous, a little bit sick to my stomach." So he starts looking for her gallbladder problem, or he starts looking for some other problem. It takes a while sometimes to identify that a woman is having a heart attack. That's not a good thing, but that's a fact. And what that leads to is an idea that it's better to stay out of the hospital and prevent this problem. Act early to modify your risk factors, because as a healthcare process, we don't do very well in terms of diagnosing women with heart problems. This says the same thing. Not only do we have a problem diagnosing women, but after women get to the hospital, they're less likely to get aspirin, beta blockers, cholesterol agents. As a proceduralist, women have smaller blood vessels, and so our outcomes when we treat women for strokes, when we do what's called a carotid endarterectomy to remove a blockage from a blood vessel, when we do a heart bypass, our results, frankly, are not as good as they are with men, because women have smaller blood vessels. There are a lot of ways and a lot of things that lead to the fact that women having higher mortality when it comes to heart disease and stroke. And for all the women who are a little bit younger in this room, and you say, well, of course you're talking about my mother or my aunt or my grandmother. You cannot be talking about me because I'm a very young person. 9,000 women in the United States younger than age 45 sustained a heart attack last year. So it's not necessarily a disease of an elderly person. This can affect younger people. All of these lead to this basic principle. Basic principle is that we need to practice prevention. We need to instruct you how to eat better so that you can avoid heart disease. We need to instruct you how to exercise more efficiently. And we need to do our part to keep you outside of the hospital. But again, that's a little bit counterintuitive, because hospitals don't make money when you stay at home. Doctors don't make money when you stay at home. Seminars like this, critically important to get this message across. We want to switch gears for a second. I want to talk about stroke. You all know that there are strokes, and they all affect people's brains, and I told you how significant they are. There are 2 types of stroke. One type of stroke is in someone who has high blood pressure, and essentially your blood pressure becomes very high and it causes you to bleed into your brain. The other type of stroke is from someone who experiences a plaque that breaks off from their neck and heads to their brain. And that causes a lack of blood flow to a certain area of your brain. Both of these are very, very bad. And they're very bad because they affect women disproportionately. And they leave women, those women who survive, over 60% of women are severely disabled from a stroke. So if you don't die, you live, but sometimes you wish you would not have lived because you're severely disabled. You may not be able